I think the world is getting some real unfortunate and horrific reminders this week about the fact that there are definitely people that we do not care about. We started out the show talking about the different experiences that various racial groups are having, just trying to flee a country that is now being bombed from the sky. And so we're clear that there is a pattern of disregard for the communities, out of which we are now seeing some of these variants emerge, as you noted, simply because they don't have access. Dr. Hotez, this is something that you are not new to, this idea of global vaccine equity. And this is something you've been working on for quite some time. And your efforts in this arena have been, you've been nominated for a Nobel Prize. I mean, the world is very clear about the contributions you have been making to address these inequities in vaccine access. And we're going to be tweeting out some of the infographics and the resources that we have that will help to explain this a bit more. But can you talk with us about Corbevax? One, am I pronouncing it correctly? But can you talk with us a bit about what this vaccine project that you have been one of the folks leading, what is it, and what difference are you hoping that it will be able to make for those countries, communities, spaces, parts of the earth that we tend to disregard?
Sure. So we have a very interesting research institute called the Texas Children's Hospital Center for Vaccine Development. It's based at Texas Children's Hospital in the research building, and it's part of Baylor College of Medicine, and it's co-led by myself and as you pointed out, my science partner for the last 20 years, Mary Elena Bottazzi. And we've been using a technology that's actually kind of boring. It's been around for decades, and it's good that it's boring, because that technology, which is microbial fermentation in yeast, it's a vegan technology. First of all, no animal cells, no human cells, no animal protein, no human protein. So it could be used, for instance, to make vaccines that are halal, for instance, for Muslim majority countries, which some people find attractive. That technology is very similar to the one used to make the recombinant hepatitis B vaccine that everybody got as kids. And so there's already a comfort level for it, because parents have been vaccinating their kids with that technology type of vaccine for decades. And to produce it at scale is already in place in Vietnam, Bangladesh, India, Indonesia. Now we're building capacity in Africa, Brazil, Argentina. So the idea is, if you want to make vaccines for diseases of the poor that affect low and middle income countries, and we've been working on vaccines for schistosomiasis in Africa, which is a disease of 40 million girls and women who live in poverty that nobody knows about, because it's for 40 million girls and women who live in poverty in the African continent. It's a horrific disease. A hookworm vaccine, a Chagas disease vaccine. So the advantage of it is it's easy to, relatively straightforward to produce. It's the least expensive of the vaccines technologies, simple refrigeration, and incredible safety profile. So around 10 years ago, we started making coronavirus vaccines, because at that time, they were orphaned, just like our parasitic disease vaccines, or the big pharma companies weren't interested. So we started making vaccines for SARS and MERS, the original coronavirus.
Hold on, Dr. Hotez. In my mind's eye, I already see people hearing that you just said 10 years ago you started making vaccines for coronavirus, and instantly the alarm bells went off, because I know somewhere right now is said conspiracy. It was a conspiracy. I knew it. Did you hear that, Dr. Peter Hotez? He just said 10 years ago they were working on the coronavirus, and we just found out about the coronavirus in 2019. What is this madness, Lurie? Dr. Hotez, can you please explain how it is that you were able to work on coronavirus vaccines a decade ago, when most of us in this country just became aware about coronaviruses in 2020?
Yeah, it's a great question. So and I appreciate the way you pitched it, because that's part of the reason why people say they don't want to take coronavirus vaccines, because they're all new. And I'm saying, no, they've been around for a while. And we started working on it because the first pandemic coronavirus actually emerged in 2002. It came out of southern China. It was known as SARS, severe acute respiratory syndrome. It was very high mortality rates, even higher than COVID-19. And it hit southern China. It entered into Toronto, and it shut down the whole city of Toronto. In fact, the only thing that got Toronto back on its feet was a Rolling Stones concert. So it took the Rolling Stones to get Toronto back on its feet back in 2003. And then we had run out of the Arabian Peninsula in 2012. And I said, look, it's just a matter of time before we have another big pandemic coronaviruses. Let's start working on it. We did. And so when the COVID-19 sequence came along in January, was put up online of 2020, I said, we got this. And we got permission, because at that time, everything was in shutdown mode. We got permission from the medical center to work in the labs for our team of 25 scientists to start making the COVID-19 vaccine. It went very well. And then we made some important decisions. First of all, we decided we're not going to patent it because there was so much bickering going on around Moderna and Pfizer around patents and patent restrictions. Finally, I said, look, when your house is on fire, you don't call the patent attorney, you call the fire department. So we want to be the fire department. And we licensed it with no patent, no strings attached, to 4 vaccine producers in low and middle income countries: Biological E in India, Incepta in Bangladesh, Biopharma in Indonesia, and they've been making vaccines for the world for a long time. And then a new enterprise actually building bricks and mortar in Botswana so we can have vaccines made on the African continent.
Now, Dr. Hotez, if you're not patenting this vaccine, how are you supposed to get rich, sir? I mean, that is the point, right? We do science and we create these products to sell them at really exorbitant prices. And we will even acknowledge that maybe an African country wanted to buy a vaccine. We'll even take some of their money, but then we'll divert the vaccines at the last minute so they don't actually end up getting it. This is a money-driven healthcare community, sir.
That's the problem. Right? I mean, this whole thing has become a big multi-billion-dollar incentive plan for Moderna and Pfizer. And by the way, they're still good vaccines. I took, just straight up, I took the Pfizer BioNTech vaccine. It's a good vaccine. I'm convinced it probably could have saved my life, and people should take those mRNA vaccines if that's what's available to them. But we thought, since it wasn't being made available for the low and middle income countries, we better do something. And now the vaccine was released for emergency use authorization in India towards the end of last year. Now it's being released for kids for emergency use authorization. And are you ready for the cost? It's 145 rupees a dose. And you're probably saying, okay, well, what the heck is 145 rupees? It's about $1.90. $1.90 a dose. So
no way.
It's the least expensive of the COVID. And that's why we picked it, because for all of our parasitic disease vaccines, like schistosomiasis, our health economists used to say, hey, Dr. Hotez, if you want to make that vaccine, you better make it for under a couple of dollars a dose if you really want to get it used and accepted. So from the beginning, all we know how to do is build in low-cost processes and how we make vaccines. And it's worked out really well. And now Indonesia is making their own version of it, which they're making as halal, as I said, because they want to use it for Muslim majority countries. And the exciting part is Botswana now also is now building a bricks and mortar, a large production facility, not only for our vaccines, but other biotechnologies on the edge of the Kalahari Desert. So the president of Botswana came to visit us in Houston last year, and he's a very impressive guy. And so now we're partnering with Botswana and with a company called Immunity Bio, which is headed by another very interesting man, Dr. Patrick Sung-Shung, who owns the LA Times and part owner of the Lakers. And he's a physician, a surgeon who of Chinese descent, but he grew up in South Africa and wants to give something back to South Africa. So we're working with him for Botswana. So it's a very exciting time, a very exhausting time, and a lot of early 5 a.m. Zoom calls with India and in Indonesia, and late nights talking to the nation with Don Lemon. So I haven't slept in over 2 years, but it's good. It's good to do something meaningful.
I got to be honest with you, Dr. Hotez, for the audience that can't yet see you, because this video will be released after the audio, you are not a Black man. Unless, the one drop rule applies here, which quite frankly, in this country, it always applies. But how is it that you were able to develop such a sensitivity to the needs of people who don't look like you, while coming from a society that raises Americans to be very self-centered and inward thinking? You mentioned SARS and MERS, and I'm like, well, yeah, of course, Americans don't know about that. We don't we don't do international news, unfortunately, in this country. How did you develop the type of sensitivity that would allow you access to pathways that would or could lead you to phenomenal financial success? And yet it seems as though you have rejected that out of a sense of doing good for the world. Excuse me if I sound a little cynical, but as a fellow do-gooder, I am just shocked at discovering or realizing that there are folks like you who are doing this work, particularly when there are other examples of how you could do this work and still make a huge profit, and yet your heart does not seem to be in that space. How did you develop this sensitivity?
Ever since I was in high school, I've wanted to make, I'm probably one of the most goal-directed people that you'll ever meet. I wanted to make parasitic disease vaccines for the poor, and always had that humanitarian drive. And I wound up doing my MD and PhD in New York at Weill Cornell Medical School and a place called the Rockefeller Institute for Medical Research, now the Rockefeller University. And their motto is Scientia pro bono humani generis, science for the good of humankind. And I started I got permission to start developing a hookworm vaccine for my doctoral thesis at Rockefeller University. So it's something I've always been passionate about. And then what really cemented it for me is kind of interesting. I haven't talked about it much. Was when early on I went to Guatemala and did pediatric rounds in the hospital there, the big public hospital, Hospital Roosevelt, and I would see malnutrition and Chagas disease, and that's when the light bulb went off. I said, how can it be that I can get to Guatemala faster from, at that time I was on the faculty at Yale, from New Haven, then I can to other parts of the US, and I'm going back in time 100 years and seeing malnutrition and Chagas disease, and where's the outrage, right? So this is when I decided to really devote my life to making vaccines that no one else would consider making.
And it seems as though, Dr. Hudson, it seems as though Dr. Hotez has been very successful at that. We have this patent-free vaccine that can be scaled at a very low cost. It doesn't require extensive refrigeration at sub-zero temperatures. You're literally, we're watching as vaccine equity is being built. And not just vaccines that we make here and send to other places, but actually allowing those recipients or the locations, the low vaccine countries, to have access to the technology that they'll need, building the infrastructure in places like Botswana. This feels like, Dr. Hudson, a completely winning formula. I don't see what the downside is here. Why aren't we seeing more medical or more approaches to medical challenges in this sort of model? Where are the other examples where we're seeing the work of the type that we're seeing Dr. Peter Hotez and his crew engage in? Where are we seeing that reflected in other parts of our medical community?
Oh, wow. That's a good question, especially now that, we're shining a light on health equity, and it's already been extensively colonized. We're always laughing to ourselves about whether there's equity and health equity research.
Well, by the way, I'm gonna interrupt for a second and say, one of my sources of inspiration in this pandemic has been Dr. Hudson and Hood Med Chat, getting the word out there and giving me a voice to reach people of color across the country. That's really been meaningful to me. And the other I did a podcast, just a local guy, wonderful man, a pediatrician around Richmond, Virginia. Dr. Eric Freeman's his name, and he invited me to go on a podcast with members of his church to talk to them. One of the historic Black churches in Richmond, Virginia, and his pastor was on, and at that time the vaccine hesitancy rates in Black and brown communities was starting to go down. And so I asked the pastor, I said, what do you think's going on here? What good things are happening? And he said, it's docs like you and Dr. Hudson, but the other thing he offered, which I thought was really interesting, was he said, the clergy in Black churches across the country got together and said, we're not going to put up with this. We're going to take this on. And I think he's onto something. I think the unwritten story is about the role of Black clergy had in reducing vaccine hesitancy in the US, which I think is going to be a very important story when that finally comes out.